Bismillahirrahmanirrahim. Awaras Ashara Mubarakani Wazma Akamola Tawalla Umru Sharifila Yawmiddin Ye Maulana Ali alayhi salam na Kalam Mubarak ma si barakat laine bayan farmayu. Ehma Maulana Ali alayhi salam farmawe che Talabato salamat fi wajato fi ibadi. I sought safety and I found it in ibadat. Huzur Allah has continually encouraged and exhorted us to maintain our physical health, saying that in movement there is barakat. Harakat ma barakat che. One major reason for this is so that we can partake in the various arkan of ibadat in the way that we are meant to do so. To assist us in maximizing our physical potential, SBMAA is proud to present a CME talk titled A Prescription for Exercise, presenting Dr. Hujefa Vohra. Dr. Hujefa Vohra is an internist who has practiced in the Arlington, Texas area for almost 20 years. He started his solo practice with his wife Insia as his business partner. In the Jamaat, he has long served in his medical capacity as the lead for many Jamaat medical initiatives, including most recently Miles for Mola, as well as many health fairs, immunization drives, and educational programming. And he is currently the head of Umur Sehat for the Dallas Jamaat. Please join me in welcoming Dr. Hujefa Vohra.
Perfect. Ooh, now you can hear me even better. So, I'm going to mess with that for a second. There we go. All right, cool. So, I have a very important job for you, Sab. Right now, I'm wearing my heart monitor. We're going to talk about heart monitors in a minute. But you can see it's in the blue zone right now. Oh, it turned green because I'm starting to get a little bit nervous in front of you guys, all right? So, Sab, I need you to watch this heart monitor for me. And if it gets into the orange zone, I want you to seriously think about shutting me up. And if it gets into the red zone, are there any cardiologists in the room? All the cardiologists left me? Good God. I'm in trouble then. All right. So, Sab, I'm leaving this right here for you. I just went into the green zone. That's not good. All right. So, it's my distinct honor and privilege to talk about exercise with some amazing doctors. I've been here for 2 days, and I'll tell you, as the last speaker, I'm more nervous right now than you can even imagine, because I've heard and I've been present at these amazing talks that all have all sorts of science and charts and graphs, and they're presented by just the most phenomenal, smart, intelligent, amazing doctors I've met, ever. And now you get stuck with me. Sorry about that. Where's my clicker? Does anybody know where my clicker is? On the podium. It's on the podium. Good. I'm not on the podium, which is trouble for all of you. Clicker. No lightsabers here. This is me being nervous too. All right. Am I getting into the orange zone, Sab? Okay, good. Down is forward. All right. Good. Perfect. All right. That did not work. Ooh. All right. So a couple of disclaimers. Because this is CME talk, I have to get my disclaimers out there. First and foremost, I have no financial ties to any organization, nor do I receive any monetary benefit, although I did try to convince Amir Bhai that I needed to be paid for this. He said I wasn't worth it. So, sorry about that. So, nor do I receive any monetary benefit from discussing this topic with all of you today. In fact, I'll tell you that talking to my patients about exercise, when they take my advice, and they do every once in a while, and they do it right, it often leads to less money in my pockets in this fee-for-service and quality metrics world that we live in. So that's why I kind of needed the money Amir Bhai. Just a little shameless plug there. All right. I want to tell you all that I'm not a fitness expert, all right? I'm just a simple country doctor. My wife said for me not to say that. But it's true. My practice centers around preventative medicine, diabetes, heart disease, and I'm telling you, you all know, you all are doctors, we all went to medical school together. They don't teach you any of this in medical school. I mean, so a lot of this stuff I picked up on the fly. And somebody thought that it might be nice if I tried to share some of this with a bunch of important people, which is why I'm probably in the orange zone now. No. Okay, good. I can keep going. I've spent, on a very personal note, I've spent my entire life fighting the battle of the bulge, all right? I have always had a BMI. Anybody know what BMI is? We all know what BMI is, body mass index. We're not going to talk about that too much further because I start to get palpitations. But my BMI has always been greater than 35 my entire adult life. Most of my pediatric life, too. Some of these guys have known me since I was very young, and they know that the bulge has been there. My stomach was probably bigger than I was when I was 6 years old. I don't know how that happens. But what has kind of helped me to get through this is that most of you already know, some of you already know, that I'm an avid cyclist. I'm a fanatical skier. I probably shouldn't be. Some of you all know my story, and I'm not going to go into that too much, but I probably should quit skiing soon. I'm not going to. I'm a terrible golfer. Some of you are like, that's not exercise, that's some weird game where you shove a ball around. Well, I tried to get onto the golf course, didn't work. And I'm a member of a cult organization, and this part of my disclaimer is super important. I'm a member of a cult organization called Orange Theory Fitness. Anybody know what Orange Theory Fitness is? Nice. Any members in here? Am I the only one? Shame on all of you. All right, sorry. I get a little crazy. I apologize. Whew. We're going to talk about that one too later. So when I started my own fitness journey, we all kind of have this story. And my fitness journey actually didn't start with this picture, but I keep it up here because it reminds me of where I was and who I am and why I'm standing here. We've all had this experience where a patient comes into our office and says, "Doc, listen, I need you to help me because I don't want to be a diabetic. I don't want to be this. I don't want to be that. I just need your help." Well, my fitness journey started about 15 years ago with a patient that came to my office, and he said I could use his name, so there's no HIPAA violations here. I've already broken the law once during this conference. His name is Rick Wilson. And we've all got a Rick Wilson in our practice, a patient that comes in and they're totally healthy. They don't need you. They're walking in and Rick Wilson would run on a normal, I'd say run, he would bike, wouldn't he? This guy, when I met him, was 45 years old, which is a little bit younger than where I am now. And when I met him, he walked in and he said, "Doc, I just need a physical. I don't need you to tell me anything. I just need you to check me out." And he said, that was kind of weird. Why would he do that? Well, the reason he did that was because he had to go on a bike ride. And he just wanted to get checked out. He just wanted an EKG and some blood work. And how much did this guy ride? Well, he ends up telling me he rides roughly about 400 miles a week at 45, all right? And at the end of our visit, he says to me, "I'm going to come back and see you in a month." So we go through that whole rigmarole. I see him again in a month, and he comes back and we go through all of the annual stuff. We go through all of the physical stuff. We talk about his blood work, and at the end of it, I tell him that he's doing a good job. And he says, no crap, Doc. Let's talk about you. Everybody have a Rick Wilson in their practice? So Rick tells me, Doc, I like you. I want you to be my doctor for years. But I'm going to tell you one thing. If you don't straighten up and fly right and take your own advice, I'm out of here. And you'll never see me again. And isn't that just a powerful moment for all of us? Because we've all been through this. We have patients that we want to get rid of, and we're like, if he says he's going to get out of here and never come back, I'm going to be so happy. But when Rick Wilson said that to me, it changed my thought, my entire thought process about what I was doing. Because up until that point, I was a medical student. And I was doing everything that I had been taught how to do in medical school. And I wasn't helping my patients because I didn't know how to. I didn't know what I was doing. And Rick Wilson told me that. And he said, I want you to be around. And he reminded me that we are perpetually medical students. Perpetually. And that I needed to straighten up and fly right and take my own advice. And not only take my own advice, but learn how to give that advice and what the right advice was to give. In that moment, I became a patient. And my patient, Rick Wilson, became my doctor. And I'll tell you that Rick still sees me today, 15 years later, and my staff knows that when he comes in, it's an hour-long visit, automatically. That's what my schedule looks like. Just block it off right there, because it's my visit, not Rick's. I'm going to get the advice, and now he calls me Doc. We get called Doc, but he calls me Doc, and I call him Coach, because that's what he has become. He's become my coach. And so when Maria, my daughter, where is she? She's somewhere over there. When Maria was born, this was somewhere, what was it, 8 years ago? Are you 8 years old? Yeah. So when Maria was born 8 years ago, Rick said, you need to do something for me. And I said, geez up. Right? He said, you need to go buy a bike. And this was also about the time of, no, it wasn't, was it? Somi Milad. Somi Milad happened a couple of years before that. So I'm mixing up my stories, sorry. But at Somi Milad time, Rick Wilson told me that I needed to ride at 100 miles from Vohra. And I thought he was insane. But he told me what bike to buy. I bought that bike, and I started riding. And when Maria was born, I remember taking this picture. At the end of, not a 100-mile ride, I only got to 84. Because it was 100 degrees outside. Anybody tried to ride a bike in August? It's insane. All right. So, introduction. I want to give just a quick outline of our program today. And I know because I tend to ramble, we're not going to get through all of this. I'm already rambling. So we're going to get through as much of this as we can. And I'm going to try to keep it a little light because, I know a lot of you think I'm really serious, and I'm going to try to lighten it up a little bit, all right? A quick outline of our program. Of course, when we're talking about CMEs, I have to give you the obligatory clinical scenario. I think I already did, but we're going to go through a different one. Then we're going to go back to medical school where it all began, and some of my med students are going to laugh at me and say, this guy has no freaking clue what he's talking about. And you guys out there who are like 20 years removed from medical school are going to say, that sounds pretty interesting. All right, cool. Then we're going to talk about some concepts of physical and mental fitness. Then we're going to get to some meat, discussing exercise with your patients. Then we're going to talk about setting goals for fitness. And we're going to talk about writing a prescription for fitness, which is the meat of where I want to end up. And then, if there's any time left, which there won't be, I'll open it up for questions and maybe some discussion. All right? So let's see if I can do this. So here's my obligatory clinical scenario. All right, Sheikh Mansour is a 45-year-old Indian Mumin male. My brother's going to kick my butt for this. With no significant past medical history, who presents to your office for his annual physical exam. And this is where I start to lose the specialist in the room. He has a strong family history of diabetes and coronary artery disease. Family history. He doesn't smoke, he doesn't drink, doesn't use any drugs. He's a good guy, he takes tali, goes to masjid 17 times a week. I'll tell you that the pandemic has really stressed him out. He's working from home. He's sitting in front of his computer all day. His activity level's kind of low. He tells me I walk around the house every day and all the time. And, occasionally I walk around the block, right? We've all had this patient, except my brother doesn't have that accent. He actually talks with a very thick Texas drawl. Worse than mine. On your examination, Sheikh Mansour has a BMI of 36, which he doesn't, I do. His exam is otherwise unremarkable. His labs show some elevated triglycerides. He's got a low HDL. He's got a high LDL. And his hemoglobin A1C is 6.1%. So he wants advice on what to do. What are you guys going to tell him? This is where I open up the floor. What's that? Diet and exercise. Bingo, flingo. I like that, right? Huh? Of course, the surgeon in the room is going to say it's time to do a gastric. BMI of 36. No medical history. All right. Okay. That's what I'm going to tell him what to do. All right. So these are great. This is great, right? What did I tell him to do? Well, I told him to move it. A good goal is doing at least 150 minutes a week. But if you don't want to sweat the numbers, just move more. Find some forms of exercise you like. Stick with it. Build more opportunities to be get more active into your routine. Sounds very reasonable, right? Right? And then what do you do? What do you do after you say that to them? Yeah, you move on to the next patient because, dang it, I don't have time for this. Get your exercise in. But as doctors, do we really know what that means? Do we really know what we just told our patient? Because that's the answer off the American Diabetes Association website. Or I think it's maybe, sorry, I remember I was going to get mad at me again, but it's the American Heart Association website. All right? And that's the exact statement. We say it all the time because that's what we get told to do. But what does it really mean? Well, that's what I'm going to try to get into a little bit today, all right? So before we kind of go in, I'm going to do about 4 minutes of exercise physiology. Please, someone wake Mustafa Bhai up when we're done, all right? Please. It's not going to be 4 minutes. It's going to be more like 2 because otherwise Alifia Ben will get really mad at me. So skeletal muscle fiber. Let's talk about skeletal muscle fibers for 2 seconds. There's 2 types, type 1 and type 2. That's it. That's all I got for that. Okay. There's actually a lot more to that, but I'm not going into it. All right. So let's talk about the 3 energy systems of exercise. And this is where I want to get one of my medical students up here. Any medical students? All right. You want to come up here with? No, forget it. All right. I'm not going to rehash all. Does anybody know what this is? The Krebs cycle. All right. 10 points for Gryffindor. Excellent. So I'm not really going to rehash all of this stuff because clearly all of you guys know plenty about the Krebs cycle or the TCA cycle or the electron whatever chain, transport chain or whatever you want to call it. All right. I want to hone in on 3 areas of this, okay? I want to talk about the phosphocreatine shuttle. Does anybody know what this is? I can't even say it. I figured out how to say it about 3 weeks ago, and that was the end of it. Phosphocreatine shuttle is where creatine kinase splits inorganic phosphate, where am I on here? From phosphocreatine and then combines it with ADP to yield ATP and creatine. Okay? The phosphocreatine shuttle is important because it's your system for immediate energy. When you're getting up and you're going to take off sprinting, this is your system, all right? But it only lasts for about 10 to 15 seconds. I think this slide says 8 to 10, somewhere around there. Mine is well honed at 10 to 15, all right? The second system that kicks in is your glycogen lactic acid system, glycolysis, all right? More biochemistry here. Pyruvate derived from glycolysis is converted to lactate without oxygen, so it's anaerobic. Anaerobic, I got that one right. Yielding 2 molecules of ATP, all right? Lactate, which we're going to talk a lot about later, is moved extracellularly. It's buffered by bicarbonate, and it produces carbon dioxide, which we breathe out. Breathing, excellent. All right. Now, the third system, glycolysis is important because it's your intermediate short-term energy system. All right? It's the system that, once you've started going, accelerates you. All right? Then we've got our third system, which is the oxidative phosphorylation system. And this is where, you get the metabolism of glycogen, glucose, fatty acids. All of this produces pyruvate, Krebs cycle. Pyruvate gets converted to acetyl-CoA. Forget it, dude. The important part of this is that oxidative phosphorylation is the long-term energy system of the body, all right? And it produces like 26 molecules of ATP per molecule of pyruvate. This is important because this is the system that keeps you going. Once you've started to run, this is what keeps you going for that long run, all right? So, I want to summarize this one more time. We're all athletes, and life is an obstacle course. So as an athlete, which system are we going to target when we start to exercise? My answer is always, I'm one of those all or none guys. All. If you're running an obstacle course, you're going to get through the distance part of the race by engaging answers on the board. No, by the long distance part of it, the running distance. Oxidative phosphorylation, right? When you get to that steep hill where you got to run up and you're going to have to accelerate a little bit, you're going to use the glycolytic pathway, all right? And if you have to for all those obstacles in the road, which many of us have in our daily lives, we're going to need the rapid ATP production from the phosphagen system, all right? That's about as scientific as we're going to get the rest of this way, all right? Now I'm going to kind of get a little mushy with you, and we're going to kind of ease it up a little bit, all right? I want to talk about some concepts in physical and mental fitness. And a lot of these are my ideas that I've kind of developed over time with my, taking care of my patients and being a patient of Rick Wilson myself, all right? What exactly is fitness? Can anybody tell me what fitness is? What does it mean? What does the word fitness mean? I mean, we're always talking about, we got to be more physically fit, got to be more fit. What does it mean to be fit?
6 packs.
Oh, 6 packs. Like Homer Simpson right here, right? Right? So what Bicep is telling us is kind of the elephant in the room, right? That Homer Simpson on the right is not physically fit, is not fit, right? And I would argue, who said perception? 10 points for Gryffindor. No, you're not on Gryffindor, are you? Slytherin. Yeah. Sorry, I don't have my sorting hat up here, so I forgot. I'll tell you that fitness is perception, but it's not perception of everybody else, it's perception of yourself, right? So I'll tell you that I kind of look like that guy on the left a little bit, or I used to. Now I kind of tightened it up a little bit because I sucked it in. And I want to look like, I think when I look in the mirror, I see, and my wife sees, the guy on the right, all right? But at the end of the day, we know that neither one of those things your perception is not actually totally, it's somewhere in the middle there, right? Right? Please say yes. Please say I'm not far left, all right? Oh, goodness gracious. It's a tough crowd. It's a tough crowd. See if I can get this thing going. Point it this way. I keep pointing at the screen. So we talked about this. Physical fitness, cardiovascular endurance, muscle strength, endurance, mobility, body composition. These are all things that when we think about physical fitness. When we think about mental fitness, we think about being emotionally fit. My wife would tell you I'm probably not there yet, still a child. We think about social fitness, getting along with other people, or maybe not. We think about financial fitness. And we think about, and everywhere you look, you see physical fitness tied to mental fitness. So I know it's got its own little category over there, but quite honestly, I'll tell you that physical fitness is mental fitness. They're the same dang thing, all right? Think about it. A healthy diet, regular exercise, enough sleep, all of these things are physical things that we do, and they make us feel better. So, a little bit more science. I want to talk about how do we measure these things, or what kind of measurements are important. I mean, I can say, I feel good, I feel great, but what kind of things can we measure to tell us we're feeling great? I got this little monitor right here, and Bicep will tell you that I got down into the blue, right? Which means now I'm a little bit relaxed. I'm in the zone. I'm good. This is my happy place. But, so maybe I need to look at something like that. I don't know. Where does this come from? Well, I'll tell you that one of the most important predictors of physical fitness or mental fitness and endurance is the idea of aerobic capacity. It's a measure of how much oxygen you use when exercising at a sustained maximal workload. Think about this. The less fit you are, the less your aerobic capacity is, the less your ability is going to be to sustain a high effort. If I tell you guys to run across the room, some of us are going to make it really fast, and some of us are going to make it a little slower. That's probably going to be me. And then some of us are not going to make it at all if we try to run across the room. Because as we get older, as we get less fit, that aerobic capacity goes down. All right? In the athlete world, this is not in the doctor world, but in the athlete world, they measure aerobic capacity with something called a VO2 max. Anybody heard of the VO2 max? I got these guys. I love you guys. Staying right here. That's my zone right here. All right, good. So the VO2 max is something, basically, it's how much oxygen you're capable of processing per minute relative to your body weight. So milliliters of oxygen per kilogram of body weight per minute. All right? VO2 max is something that the athletes like to measure, and it's been shown it steadily declines with aging. And this decline actually is slowed dramatically just even by mild regular exercise. How do we measure our VO2 max? Anybody measure VO2 maxes here? We don't. We don't, because you got to get on a treadmill, you got to put your patient on a treadmill, put them on a mask, and get them running and start. It's a big process. So it's a difficult thing to measure, and we don't really do it in the clinical setting. Pulmonary rehab folks do it. That's what I was kind of looking for. So the pulmonary rehab guys do this, and super important. If you ever want to get your VO2 max checked, that's the place to go. If you want to figure out when you're going to die, watch that VO2 max slowly decline over time. Graph it out. You'll be dead by the time that VO2 max hits 40. All right? It's a perfect predictor. Did I say that out loud? Yes, I did. Okay, good. Yeah, I know, right? The second predictor of fitness and aerobic capacity, and endurance is lactate threshold. Your lactate threshold is the intensity of exercise at which lactate begins to accumulate in the blood at a faster rate than it can be removed. What the heck did that mean? We're going back to the Krebs cycle, baby. When that lactate level starts to rise in your blood, what happens? Well, it gets converted into all that crazy stuff, and hydrogen ions are produced. So lactate's not really the problem. When pyruvate's converted to lactate, unbuffered acid, hydrogen ion, is added to the blood, okay? So acidosis is the problem. And biochem quiz, how can you tell when you've hit your lactate threshold? Anyone? The pH change. The pH changes. But how can you tell when your pH changes? Yeah, the muscle aches, your muscle starts to fatigue. You just can't go anymore. And some people throw up and do all sorts of crazy things when they get acidotic. All right? So generally, the lactate threshold is a measure of how long you can go. So if you go as long as you can go for about 20 minutes and measure how fast you ran, what your heart rate was. What's my heart rate, Sab? I'm good. All right, blue zone. Excellent. So when you can check that lactate threshold and you can exercise to that threshold and you'll live longer. Wow. All right, this is cool. All right, this is cool stuff. So my third predictor of fitness and endurance that I like to think about with my patients, and I'm going to tell you guys, I want to back up for 1 second and just tell you that when I talk to my patients about this is what I talk to them about. This is what I talk to them about when I'm talking about exercise. I don't bother just telling them, you need to exercise more. I say, hey, let's get into it a little bit. Let's dig down deep and understand what you're doing and why you're doing it and what you need to do to get to where you need to be. This comes down to something that the athletes call economy. And this is how efficiently your body uses the oxygen that it gets while exercising. It's kind of like a car. My daughter's yawning. I'm in trouble. Love you, baby. All right. So we talk about the efficiency of a vehicle, right? This is really simple. Economy comes down to how many miles per gallon your car gets. How many miles per gallon do you get, boss? 40. Right, 40 miles per gallon in your car? I'm talking about you. At least. This is how far we get. When we talk about economy, we're talking about how far can we get? And how much energy does it take to get us there? So these are kind of the three phases we've talked about. I want to try to remember these things. And we're going to move on to the next section here. Wait a second. There's a couple other predictors that I didn't talk about, and I just want to mention them because I know you guys are thinking it. You're thinking about weight. He didn't talk about weight. Did I mention weight, Sam? I didn't mention weight. And the reason I didn't mention weight is because I did. Remember that VO2 max is dependent on your weight. So the higher your weight, this is math for some of you guys, my medical students, VO2 max, as your body weight goes up, that VO2 max goes down. So if you're heavier like me, you're already running at a disadvantage on my little death curve that we talked about. All right? There's also waist circumference. Some of the cardiologists like waist circumference. It's a function of the weight, and that kind of translates well into BMI. And the cardiologists like to talk about it. I don't like to talk about it, so we're going on. And then my third other predictor that I have mentioned, but I didn't mention here, and now I am, is your maximal heart rate. Anybody know how to calculate a maximal heart rate?
You run 100 meters, and at the end of the 100 meters, take your heart rate, and it's 80% of your stop heart rate.
Nice. That is perfect. That is the beautiful answer. If I ever told my patients, did everybody hear that answer? No. Sorry. Let me repeat it. When you tell your patient, I'm telling you guys, go run 100 meters, and when you measure your heart rate at the beginning, you measure your heart rate at the end, then you take 80% of that heart rate at the end, and we're going to consider that your maximal heart rate. Did I summarize that correctly? Yeah? Good. Any of your patients ever going to do that? No. So I use a very simple formula that's total bullcrap, but it totally works, and it's kind of the accepted way of doing it. 220 minus your age. So my maximal heart rate is 204. No, it's not. Sorry, it's not. It's actually like 172 or something like that. Dang it, I'm getting old. That's the Alzheimer's kicking in. Sorry about that. I want to go back to what I said earlier, because all of that stuff we talked about measuring, they're immeasurables. I mean, so for the purposes of today's discussion, physical fitness equals mental fitness. Can we measure mental fitness? Everybody's kind of shaking their heads like probably not, and I think that's correct. There's not really a great way to measure it, so we kind of just do CT scans of the head and we see what it shows. That's what mine shows, except for the beer part's up. So how do we talk about this with our patients? Well, I tell you that I tell all of this science to my patients. We talk about it, and a lot of this stuff goes over their heads. And I try to simplify it, overly simplify it, because some of you in the room are saying, okay, that was totally incorrect. But that's just, we got to oversimplify. I oversimplify things because my patients look at exercise like climbing this wall. They're like, you want me to exercise? What the heck does that mean? I can't climb that thing. It's not going to happen. I always tell them exercise is all about how we feel. How do we feel as we get older? Well, there are certain things that we can measure that limit our functional capacity. We talked about the idea of decreasing aerobic capacity. We talked a little bit about increasing body fat. And one that we didn't mention that bears mentioning here is the idea of shrinking muscles. Our muscles shrink as we get older, as we get less fit. And we kind of mentioned that a little bit earlier, but again, my patients don't always understand that. They don't care about what their aerobic capacity is. Exercise is all about how we feel. So I always tell my patients exercise is kind of a panacea. You know, it's a cure-all. Everybody can do it. Everybody needs to do it. Even a low to moderate level of exercise can slow and even reverse these effects of aging. So increasing our aerobic capacity, decreasing our body fat, increasing our lean muscle mass. Most of my patients don't care about this either. Again, we're going back to, they just want to feel better. So I always have to kind of tell them, so I kind of push it a little bit further. Let's talk about the risks and benefits of exercise. This is a simple way to go, right? We're treating a patient with something. We tell them a little bit about it, and then we say, hey, let me tell you about the risks and benefits of the gastric sleeve that Mustafa Bhai is about to do, right? He didn't hear me. That's all right. It's okay. Are you good? Okay, good. Sorry. I mentioned your name, and you didn't even perk up. Now I'm talking about gastric sleeves, and who knows? I don't even know how to get your attention anymore. So we discussed the risks and benefits of exercise. And can anybody tell me what the benefits of exercise are? What do we tell our patients? Again, if you just forget and can't think about it, the answers are on the board. Of course, they're kind of far away, aren't they? Hard to read. Some benefits of exercise, Chief.
Better sleep.
Better sleep. This guy needs to sleep. It's true. He's been working hard. Anyone else? Come on. Better, some things that makes you feel happy. Better bone and joint health. Where's Mufaddal Bhai when he says that? I love you, brother. What else? Look good, feel good. We like to tell people it decreases your all-cause mortality, makes you live longer, live better, less chance that maybe you'll have a heart attack or a stroke or die of diabetes complications, something, right? And we all know this. This is easy. I think they taught us this before medical school. This is pre-med, right? Maybe? Elementary school? I don't know. And what are the risks of exercise? Well, this is simple too, right? Because the answers are on the board. Boss.
Overtraining and injury.
overtraining and injury. I get that all the time from my mom. Where is she? She's in the back. Always telling me, my joints hurt too much. She's 70 years old, you guys, so I'm picking on her, right? But we all have these patients. It just hurts too much to exercise. Doc, why are you telling me this? I got coronary disease. Where's Amirbhai? I got coronary disease, right? What the heck are you? I might die out there. You want me to run a mile? You want me to run 3 miles? You're crazy, right? I'm going to tell you, and this is the only study that I've shot on my board. This is the only study we're going to talk about today. Actually, that's not true. There's one other one, but this is the only real legitimate one. The other one's fake. It's a study done at Harvard somewhere. Where's Ali Asghar? He's not here. Oh, Harvard, love you. All right. Talking about the beneficial effects of physical activity on coronary heart disease. And you'll see that folks that are inactive, it's kind of hard to read, isn't it, Sab? Sorry about that. When folks that are inactive have a 12% risk of cardiac event, which includes heart attacks and arrhythmias and death and all the stuff we're talking about over there, right? That's if you don't exercise. If you start to occasionally exercise, they saw that risk went down to about 8%. If you got to a light level of exercise, that risk went up just a smidge, but kind of stayed right around 8.5%. If you got to a moderate level of exercise, and we're going to talk about what light, moderate, and heavy means in a minute, but you got to a moderate level of exercise, you actually dropped your risk in half. Went from 12% down to a 6%. 50% improvement is pretty darn good, don't you think? Would you guys take that? I would take that. And then there's the folks that are crazy exercisers, the moderate to vigorous exercise people, and they kind of went back up just a smidge to about 7%, but still pretty darn good. I would take it, right? Orange theory. Who said that? Nice. That's moderate to vigorous. All right, we're going to talk about that in a minute as well. So now they care a little bit more, and we remember that exercise is all about how we feel, right? How does exercise make you feel? This is great. Let's talk about exercise and stress. How does your body feel when you're stressed out? We talked about this at the beginning of my talk because I was a little bit tachycardic. If you see, I'm sweaty. Anybody see that? It's disgusting. Sweaty, palpitations. I threw up about 3 times last night, which my wife doesn't know. Chest pain, all sorts of weird craziness, right? That's what happens when we feel stressed out. And I wasn't physically stressed out, was I? I was mentally stressed out because I didn't want to disappoint you guys. I want to make sure that we got what we needed to get out of this talk, right? So, again, mental stress is manifesting itself as physical stress. Mental fitness equals physical fitness. It's beautiful. Physical symptoms can increase your mental stress. When you just don't feel good, you don't want to go exercise. My joints hurt. I'm tired. I just want to sit. I just finished a 12-hour shift in the ER, and I just want to sit in front of the television and be a vegetable. Right? This is how the vicious cycle continues, because when you do sit in front of the television and feel like a vegetable, what happens? Do you feel better? Do you feel less stressed out? Do you feel like you're just, does it feel better? I don't really think so. Unless, Jesus?
Vegetables.
Yeah. Potatoes, right? You turn into a couch potato, which, that's another talk. That's a whole other CME talk. Thank you for inviting me to that next one. I'll do it. Exercising is an effective way to break that cycle, because all too often I tell my patients, look, you're tired, you just came home from work, you just did your 12-hour shift, doctor. I need you to go for a run. My 15 minutes. I'm dragging. One of my buddies who's a neurosurgeon lives behind me, and he gets to be my fitspiration for a minute, because he works a 14-hour day, And at 6 o'clock in the evening, when I come home from work, I always see him running right by my house. And he always tells me, I'm going for my 3-mile run. I'm like, dude, how do you do that when you just stood over a human brain for 14 hours and did all that crazy stuff that you do? You've got to exercise to break the cycle. Physical activity releases endorphins. We're going to talk about that in a second. It relaxes your muscles, relieves tension in the body. And when your body feels better, so too will your mind, because physical fitness equals mental fitness. Beautiful. I want you guys to take that home. That's all I want you to take home. Endorphins, the myth and the legend. What are endorphins? Anybody know what endorphins are? Oh, they're feel-good drugs. Somebody said feel-good drugs. That's exactly what they are. Endorphins are natural painkillers produced in the body, usually as a response to physical or psychological stress. If you do a PET scan of this, like we did with Homer Simpson earlier, it would show increased levels of activity in the hypothalamus and the pituitary glands, where endorphins are produced and released after exercise in athletes. So endorphins are painkillers, they're natural antidepressants, they're anxiolytics, and if you see people that exercise like crazy, they'll tell you that they get high after they exercise. Serotonin levels, we're going to talk about that in a minute. I love that. It also has to do with those endorphins. Those endorphins get released, and we talk about runner's high and exercise-induced euphoria, which is where I'm at right now, because I'm ready to go, you know? Exercise, again, is all about how we feel. We mentioned serotonins. And this is important. This is exactly what I was going to talk about in this slide. Exercise can treat mild to moderate depression as effectively as antidepressant medications. And this actually just came out in a study about 2 weeks ago that was on CNN, which some of you think is fake news. But it was a month ago, wasn't it? Right. Right. Sanjay Gupta talked about it. And it was an actual study that they did at Cleveland Clinic or somewhere like that, where running 15 minutes a day or walking an hour reduces the risk of major depression by 26%. People felt better. They didn't have to take drugs. It's amazing, because physical fitness equals mental fitness. In addition to relieving depression symptoms, what they also found was that maintaining that exercise schedule can prevent those of us who are depressed from relapsing back into that depression. So this is the crux of a lot of what we talked about, and this exercise and cortisol. We think about the fight or flight sympathetic nervous system response, all right? When you're stressed out again, what happens? All of these things kick in. You're like me, you just want to run out of here and hide under a rock because I'm stressed out, right? But what happens with exercise? Well, with moderate to high intensity exercise, the exact same thing happens. It induces a sympathetic response. Cortisol is released. And when cortisol is released, it goes in the bloodstream, your blood sugars go up, all this crazy stuff happens in your brain, and your body gets ready to run and fly, fight or flight, right? So there's been a lot of studies on this, and I'm not going to quote a single one because there's just too dang many of them. They show that exercise stimulation of cortisol production actually dampens that stress reaction. So if you take somebody who doesn't exercise and you stress them out by giving them a pop quiz, which I'm not going to do right now, but you guys thought about it. That stress that you felt right there, that normal response, if I told you guys to go exercise, this is for my medical students again, you got a quiz coming up, you got a test coming up, what are you going to do? I want you to go for a run before you take your test. Because what's going to happen is that stimulation of cortisol production is going to dampen the stress that you feel when you get into that room. This is also kind of where physician burnout comes from. This is kind of a nice little segue into that. I'm going to mention it here because the stress of life, the stress of exercise makes life stresses more bearable. And that dampening effect is the primary way when I'm talking to my patients. I don't throw Zoloft at them right away. I say, you need to exercise because it's going to treat your anxiety, treat your depression, treat your PTSD, and for some of us, if not all of us in this room, it's going to treat our burnout. How do we write a prescription for exercise? How do we write a prescription for metformin? Metformin, 500 milligrams, PO, BID, with meals. Don't take it without meals, right? How do we write a prescription for exercise? Well, I would tell you that the way we write a prescription for exercise, summarizing everything we've talked about here, is we do it the same exact way. We don't tell our patient, hey, you need to exercise. Because who goes out there and says, hey, you know what? Your diabetes is, your A1C is a little bit messed up. You need to take some metformin. I'll see you next week. Who does that? Do we do that? Why do we do exercise the same way? Why do we do it that way? We shouldn't. We need to do it this way, the way that we've been taught. So I have a nice little deal that I found a few years ago. What are these things called? Mnemonics, right? Something like that. I got my Fit mnemonic. Everybody likes mnemonics, right? My Fit mnemonic, which also describes our metformin, but here it's going to describe how we write the prescription for exercise for our patients and for ourselves. We start with frequency, F. F is for frequency. I, intensity. T is for time, and our second T is type. So frequency. What's frequency? It's the number of days. We're going to tell our patient to take metformin twice a day, every day. If they're on Trulicity, we're going to tell them to take it once a week. If they're on Boniva, they're going to take it once a month. Prolia, somebody mentioned Prolia a couple of days ago, right? Every 6 months, right? How often do we need to tell our patients to exercise? I tell my patients, I always recommend at least 3 days per week, starting. That's where we start. Consecutive days can be prescribed only as long as the patient doesn't require recovery. Because when you take a drug, what happens? You get the maximal effect, right? And then the half-life kicks in, and it kind of goes down and wears out. And maybe you get some symptoms or side effects, right? And then you kind of got to get your patient through that before they take that next dose. It's the same with exercise. You've got to give time for recovery from the medication, all right? This is especially important when we talk about moderate or high-intensity exercise, high-intensity interval training, which I'm going to mention today, Orange Theory. I is for intensity. How do we measure intensity? How do we measure? Does anybody know what that is? Where's my little deal? Anybody know what that is? Anyone? It's a heart rate monitor. And I usually don't wear one quite like that anymore. That one is sitting, I know some of you guys are thinking it, so I'm just going to say it. All right? It is not my butt crack. Thank you. I know you were thinking it. But what that is my belly button, because my heart rate sits right here, all right? My heart rate monitor sits right here, right above the belly button. Okay, good. Got to get that out of the way. All right? Today, my heart rate monitor is right here. Because if I was wearing it on my belly button, I'd have to flash you guys, and I just don't want to go there right now. So there it is, all right? How are we doing on my zone side? We're still blue, so I'm still good. All right. Phew. I always recommend, it says usually, but I always recommend to my patients that they need to buy a heart rate monitor so that they can consider the intensity of the exercise they want to do. And I would tell all of you the exact same thing. If you don't own one of these little gizmos, they're easy to get. Fitbit, Apple Watch makes it now. Mine is Orange Theory, which is a little weirder, but they're really easy to get. You can get them anywhere. I always recommend that my patients get a heart rate monitor if they're starting an exercise program, or if they're trying to get better, or if they're just trying to survive. We talk about time, all right? The time required depends heavily on the frequency and intensity of workout. Obviously, if somebody's running 100 miles, if Rick Wilson's going 400 miles in a clip, he doesn't need to exercise every day, and he doesn't need to exercise for any longer than what he's doing. What I always tell folks is that time is dependent on you. How far can you exercise? How far do you want to exercise? Unfortunately, the number one excuse that I hear in settings like this with a bunch of highly trained, educated, hardworking professionals is, I don't have time. How many of us have said that? Yeah, there's a lot of dang hands in the room. It's true. And for all of you that raised your hands, including me, I brought you the world's smallest violin. And it's playing a song just for you right now, all right? Because if you don't have time, you need to make it. Otherwise, your VO2 max is going to go down that curve, and you're going to run out of time. Make some time. So the most complicated thing is type of exercise. And that's really dependent on what your fitness goals are. You know, if you're working on your economy, then you're stretching, you're doing weightlifting, you're doing yoga. You're making your car engine more efficient, all right? If you're working on your lactate threshold, you want to live longer, live better. You don't necessarily want to be the world's fastest person, but you sure do want to get to the end of the race. Then I always recommend lactate threshold training. Interval training, muscle endurance training, distance running, swimming, and biking. How many bikers we got in the room that bike with me? Where are my bikers? Yeah. Where's Aziz? Where the heck is he? Oh, there he is. Nice, nice. There's my daughter raising her hand. I love that. All right. And if you're working on your aerobic capacity because you want to be, you know, one of those guys that everybody at the gym hates, then you go for the long workouts, interval training, sprints, and jumping, right? Those are the zones that we talk about. When we talk about mild exercise, we talk about economy. When we talk about moderate, we talk about lactate thresholds that we discussed earlier. And if we talk about vigorous exercise, we're talking about aerobic capacity workouts. So what did we do this morning? I didn't see all of you guys there. I saw a bunch of you guys there. This was this morning. This was our economy workout. This was us in our blue zone. I think Aziz was right next to me, and I think he saw my heart rate monitor sitting next to me. I managed to get into the green zone and stay there for about 30 minutes or so. I think I put that somewhere, but it's all a matter of how you feel. But you've got to do something so that you feel better physically and mentally. Now, Hatim Bhai is somewhere back there in the back, and he's going to give you guys this handout, which is also a handout. I'm wrapping up. I'm done. Oh, it's sent. Oh, good. All right. It's hard to see from where we are. It's definitely really hard to see from back there. All of you guys have it on your WhatsApp group right now. And I'm not going to spend too much more time because I'm out of time. But the reason I'm giving you this is because this is something I give all of my patients. And you guys are my patients right now. It's a nice summary of everything we talked about. And it tells you what zones you're working out in. And if you've got goals, it tells you what type of exercise you're going to want to think about doing. It's in your WhatsApp group, though, and I'll get it to you if it's not. All right? It's just a nice summary, and unfortunately, it's just really too busy. The last thing I wanted to talk about was strategies for improving compliance with exercise program, but I really think I'm just about out of time, so I'm going to just kind of gloss over this. the most important point of this slide really is that there are options. For those of you that are too busy, don't have the time, this is my violin right here. Use a workday walking routine. Exercise on weekends. Increase your times that you're working out so that you don't have to increase your frequency. Or increase the intensity so you can cut back on frequency. Find somebody to work out with. That's what I did. I joined a cult. Exercise at home. There's apps, all sorts of crazy apps on your phones. Or if you're crazy and want to spend a lot of money and think you're worth it, join Orange Theory. They're not giving me a discount for saying that. They should. So now what do we tell our patient? What do we tell Sheikh Mansour? I'll tell you Sheikh Mansour is not really Sheikh Mansour because my brother, if you guys have met him, is fit. All right, he's an Adonis or whatever you call those guys, all right? Freaking hate him. Never has to work out a day in his life and looks great and feels great because physical fitness is mental fitness. What do I tell my patients? I tell them everything that I just told you. I wrapped this up into a nice bow for an hour, and you guys were engaging. I loved it, and I loved that I could share this with you. I don't usually do this in an hour with them. This is usually about 3 or 4 visits before they get me all wired up and going. But they all get this. This is what they get. So I want to tell you one more story, and this is important, so please don't shut the mic off. I just want to tell you one more story, because about 20 years ago, when I got out of medical school, I couldn't do this. This is a 5K that we organized this year in Dallas, 6 months ago during the Miles from Mola campaign, which was totally amazing, and spearheaded by SBMA. We had 300 participants. Salaban's nodding her head. Good. Correct me if I get this wrong, but we had over 300 participants who all walked a grand total of about 3,000 miles. It was crazy. And we ended it with a 5K. First time in my life I ever ran a 5K. If you'd have told me when I was 20 to run a 5K, I'd have told you where you could shove it. All right? But the thing that there's 2 things that keep me going, and this is where, Alifia Ben asked me this last night when I was thinking about it. She said, what started you down this path, and what keeps you going? Well, I told you guys about Rick Wilson, and I told you about my daughter, and I told you about my wife. I didn't tell you about the most important one. And I want to end with that. I want to tell you about the story that Shah Malik al-Ashtabaisab told me once. During Houston Ashura, who remembers this? A bunch of us were here way back when. Houston Ashura, when Burhanuddin Mullah came to Houston. Most of us were here. There was a bunch of Houstonians that were here. A bunch of us worked the medical camp together. And Shah Sahib asked me one day, he asked me about my own personal physical fitness. And I thought that was pretty cool, because Shah Sahib's pretty awesome. And he said to me, let me tell you about what Burhanuddin Mullah does. He said, well, first he started by asking me he asked me a few days before about treadmills, and what a nice treadmill brand was, and what to do. This was a couple of days before. But Shah Sahib came to me, and he was talking to me about my personal fitness, and he said, so I took your advice, and we went to the store, and we bought this treadmill. I said, great, this is awesome, good, awesome. This was before I was on my fitness kick. But I told Shah Sahib, that's great. You're running around already all day long, but this is going to be good. And he said, oh, it's not for me. I said, who's it for? He said, Burhanuddin Mullah ફરમાયું છે કે વાઝના બાદ આ બધું થઈ જાય, પોતે ઘરે પધારી જાય. After working his 12-hour shift in the ER, we said that earlier, he wanted to get on a treadmill. And he did. Mulani adat hati. And at least in Houston, adat I knew about. And every day after Waz, he'd get up on that treadmill. And he'd spend an hour on that treadmill. I don't know how fast he was going, but I'll tell you, we all knew Burhanuddin Mullah. None of us could keep up with him, whether he was on a treadmill or not. For me, these are the stories that keep me going. These are the things that have kept me going to my cult, have kept me running. And these are the things that brought me here today to talk to you guys. It wasn't my degree or anything else that I did. So with that, I just want to say, I want to say one last thing, and that is that I mentioned Burhanuddin Mullah, but how did Miles from Mullah happen? Miles from Mullah happened because Fadl Mullah said, he did the exact same thing. Told us that we needed to exercise every day. And when did he do it? When we were in the middle of a global pandemic, and we needed to hear, take your vaccine, stay home from the masjid, and exercise every day. These were the three things that I remember from the pandemic. And I'm going to tell all you guys, because you guys are my friends, I love you all dearly. Get out there. Don't do it because I said to do it. Do it because Burhanuddin Mullah did it, and do it because Fadl Mullah has told us to do it. Get that exercise in so we can all live longer, live better, here and here. खुदा ताला हमारा मौलाना उमर शरीफ ने क़यामत तक दराज में बात.
Dr. Hujefa bhai.
We have two questions.
We're gonna get questions.
Or
If you can
statements?
come up. So I want to. Okay, we may not have time for questions.
We don't?
But I want to say that was a very inspirational talk. It was a very informative talk, and it was a very entertaining talk. If you can't, if the doctor thing doesn't work out, I'm sure like being a motivational speaker is there for you and probably very lucrative.
I just want to be like Moy. Right, where is he? He's here somewhere.
But shukran for accepting SBMAA's invitation to give the talk.
Thanks for having
me. We really appreciate that you did this.
Thank you so much.
Yeah, awesome. So we unfortunately we don't have time, but Hujefa bhai, Dr. Hujefa bhai is always available for questions and discussion and doesn't shy away from
This is
it.
beautiful.
Shukran.
Thank you, sir.
Okay, I am also a motivational speaker. I am also a motivational speaker. You have 2 minutes to do your post survey starting now. Please. I also want to thank our AV people for really making these mics work so well. Okay. Is everyone done with their post-survey? Will be getting his CME credit.